Hello, my name is Cobi Williams, host of Palmetto Happens with Cobi, a show all about economic development, workforce development, commercial real estate, and tourism within the great state of South Carolina. Today, I'm here with Mr. Travis Dannally of Conway Medical Center. How are you doing today, sir?
Doing great, Cobi. Thank you so much for the opportunity to be on. I'm a 40-year-old dad of three. My wife and I grew up in the area. My wife's from North Myrtle Beach. I grew up here. I was reared actually in Conway, but I was born in the Low Country in a little town called Earhart.
Yeah.
In Bamberg County. It's where my dad's side's from, and so have grown up here, literally across the street from the medical center.
Yeah.
Which is has been our home for healthcare for a substantial portion of our lives, and so for me, I've always wanted to create generational change wherever I've been at, and in this role and with this organization, with what we're going to talk about today, it's pretty amazing the generational change that we've had on this community, but also to what we're going to have in the future. And I think that's something that's really exciting is the vision and strategy about our 4 pillars of what we're working towards.
Absolutely. And how long have you been with Conway Medical Center?
So I've been with Conway Medical Center as the physician liaison recruiter for a little over 4 years now.
Mm-hmm.
Brian Argo, our CEO now, brought me on board 4 years ago when he was the CFO, COO.
Mm-hmm.
And it was something that this role was being done with other leadership, collaboratively. But he saw fit, and our former CEO saw fit to bring on a strategic position that was dedicated to liaison and recruitment work. And I know that we'll get into some of that, what that is and how that can be impactful through an organization, but also through a community and bringing in service lines or specialties to a community that ultimately can, again, bring about generational change through healthcare, education, also financial stability and sustainability, because that's a piece that I think is lost on healthcare is when you have an independent nonprofit that's been around 95 years like
Mm-hmm.
Conway Medical Center. I mean, we started on the corner in downtown Conway on Oak Street at Ninth. I mean, it was, in a carriage house there, right? Then we moved to the new hospital, which is where the solicitor's building is now,
Mm-hmm.
next to Conway Fire.
Oh, wow.
Police, yes. Yeah, so
you were in that building? Wow.
That's right. Yep. So Conway Medical Center was there, and then from there we moved out here in the early '80s, and now we've transformed into a 220-bed level 3 trauma center with level 2 peds, and over 100 providers or physicians and nurse practitioners, PAs within our mTOR network. But that's not counting the other 200 plus physicians that are part of our organization and almost 1,600 plus employees.
Yeah.
So as an independent nonprofit, we're one of the larger employers in Horry County.
Yep.
And our catchment area, our service area now really has the blessing of expanding out as far north as Little River, as far south as Murrells Inlet, and as far inland as Aner.
Can you talk about, I kind of asked questions thinking now, kind of excited to hear the responses of, so can you tell me about some recent successes or notable news of Conway Medical Center?
So first and foremost, as a Coastal alum, 2006, former student athlete, something that is near and dear to my heart is how do we create generational change in a couple areas: healthcare, education, and community impact. And the community impact more so through the business development piece of creating sustainable FTEs or full-time employment.
Mm-hmm.
So one thing that our leadership has done is exceptional well is partner with Coastal Carolina University and Horry Georgetown Tech to triangulate around the issues of staffing for healthcare, providers for healthcare, administration for healthcare. We went through a pretty challenging thing over the last 4 years, and I don't mean that to discount it, saying it's a thing, but the pandemic was mentally, emotionally, and physically draining on all aspects of healthcare, but all aspects of business, education, government, the other entities that I didn't just specify. So why does that matter? Our relationship with Coastal Carolina University, we committed $10 million over 25 years to create the College of Human and Health and Human Performance, and that is going to be, once it becomes materialized into brick and mortar, it's going to be a generational changing program. Then it's going to then bridge the Horry County or Georgetown Tech students over. We already have the 2+2 program, but that's going to create a healthcare path where those that go get their associate's degree from Horry Georgetown Tech can come right over to Coastal, or those that want to go directly into a 4-year education path, they can do so. It also gives our kids in Horry County that whether they're in a public, private, or collegiate school setting, they now can go to Coastal and seek out a healthcare degree. Nursing is the next phase of that, right? So nursing is coming on, and again, we know that Francis Marion has done a fantastic job with nursing. We have a litany of Francis Marion grads within our network, and we're very proud of what they produced. Again, healthcare. Right now, one of the largest and most impactful challenges and hurdles we face every day, Cobi, is staffing. One of those staffing pieces, front office staff, but also pure nursing. Pure nursing. And whether that's in the inpatient setting within the four walls of the hospital or in the outpatient setting in an outpatient clinic, whether that be in a community like an Anner or a Murrells Inlet or Conway or Myrtle Beach or Carolina Forest. So we're trying to combat the issues with really proactive, long-range, sustainable plans. What is the most sustainable plan? It's education. Show a man to fish, he eats once. Teach a man to fish, he eats for a lifetime.
I love that one.
And so we're trying to teach them how to fish, that being the education of healthcare. Healthcare has been around since the earliest days. Medicine's always going to be there, so we have to continue to evolve with it. Whether that be telemedicine, telehealth, to the relationship with Coastal, 10 million, 25 years. It shows a commitment to our community that we are not going to be absent-minded to the needs. We are an independent nonprofit. So I'm really excited about that. What does that do? That also aligns with what we've done with family medicine residency here. We've partnered with Campbell University to bring on family medicine residents and third and fourth year medical students. So for those that listen to this, they know that Coastal and Campbell were Big South, rivals for a long time, and we've gotten a little, we've continued that rivalry more so through baseball. But from that approach, and I find it interesting. I'm looking now. I kind of look at it over here at my over where I got my family's pictures and whatnot. I've got Chauncey and I've got the Campbell from Campbell. I'll offer this to you. In our first class, we retained one of our 8. In our second class, we retained 2 of our 8, and we're already working on retaining potentially 1 or 2 of our third class. That goes back to non-Orryites moving, non-South Carolinians moving here, finding home, putting roots down, starting families, and calling this place a home. And we are elevating, healthcare in our community while simultaneously the economic impact.
Embracing here what we have here already.
We have to. We have to. That's right. What Dr. Maxey's done with Horry County Schools has been very, very quality. He was my high school principal at Carolina Forest High School, and we've seen that. It matters because, what is it? We produce more scholarship students between athletics and academics than any other public school system in the state.
I didn't know that. Wow.
Yep, per capita, and that's something that in my role as a recruiter liaison, I'm having to advocate. Some people say, well, you're selling. I'm not selling anything. We have quality attributes to our community, and we want to bring people here who are quality people doing quality medicine. Because ultimately, we tell them, you're going to pass these people at Market Common at a festival. You're going to pass them at a grocery store, at a Coastal game, at a rec field, at church, sitting in you're going to see these folks. And we don't have, our board is volunteers, and we don't have an investment, dividends being paid out, and we're going to touch on the Navant deal in a second. And it's, for us, our investment is our people, our investment is our community. That's our accountability, right? That's for lack of a better word, that's our dividend. Is I said this on one of our podcasts here recently, the healthy happenings here that Nicole and our marketing team do. So a little selfish plug, little plug there. But
I listened to it.
Yeah, she does a wonderful job.
She does. Yep.
And one thing I touched on there was, we owe it to ourselves to bring in quality people. That's the only way you can elevate a community or sustain a community, by teaching those that are here versus also bringing those in that complement and support that. And I think we're doing that here at CMC. It's we're trying to create generational change from a healthcare perspective, but you yourself volunteers with Backpack Buddies, right?
Yeah, that's fun.
There's a generational change there. We're, through our foundation at Ted Milford and Harley, we are providing sustenance and resources to children who are potentially underserved or go without food resources or their food. They're unfortunately in a situation where over the weekends or in the summer they just don't have the access and availability. And yes, that does exist here in Horry County still.
Yep. I mean, the underserved communities are a big passion of mine. Your Backpack Buddies program here, top notch. I mean, what they're doing, Ted's doing over at the foundation. I love it. I love it. Yeah.
And that's look, that's furnished and supported by the employees of Conway Medical Center. We choose to take a deduction out of our paycheck for the betterment of children. I do it for cancer care. My mother's a cancer survivor of 17 years. My father has head and neck cancer now, and it's one of those things that as an employee you can help your community through a deduction, just a simple deduction on your payroll, right? Whether that be the Backpack Buddies, cancer care, to literacy programs, to helping out other community nonprofits that we go out and get grants for and collaborate with, right? Jennifer Maddox and then works for Ted, does a great job. It's something too. I mean, our chief medical officer, Dr. Paul Richardson, is an Ainerite. I mean, he grew up, born and raised in Ainer. Family still lives there, and he has that same passion and energy to make sure that we're connecting what we're doing with everything from the grandeur of Myrtle Beach, Kellan Forest, and Conway to those communities that are westward and northward and southward.
Embracing the past, honoring the past, maybe, if you will, while looking to the future. That's just kind of a concept. We were talking about Dr. Richardson. I was like, understand where we're at, where we've been, our communities, having the locals here, but having also those folks that look to the future. Yeah, so.
That's right. So, to use our symbolic logo as an oak tree, right? An oak tree through its lifetime will go through phases, right? It goes through seasons, right? It goes through years of growth. It has to get deeper roots, has to get longer, wider roots. It has to build a steady foundation, but it goes through growth phases, right? Year over year, but also seasonality, if you will. To use that analogy, if we are going to be Conway Medical Center, we're going to be as well positioned that we can regarding, our 4 pillars, which are ultimately patient satisfaction, employee satisfaction, sustainability, and quality. Well, Travis, those are pretty ambiguous areas. No, they're targets. They're journeys. There's an end game, yes, but the end game it's a journey. Quality changes as it should. Sustainability through education, awareness, and experiences changes. We know now more about what we can do with telemedicine and the acceptance of it, Cobi, on the other side of the pandemic. For those that, again, listening to this, the pandemic was a very mentally, emotionally, physically challenging time for this entire world, especially our country, and especially this community. Taking all the social political pieces out of it, what can we learn from it? What we did learn from it was we can weave in the virtual medicine, virtual piece to what we do from healthcare, and it can be effective and productive. It can take the geriatric patient who does have to come see one of our specialists in person, but can do the follow-up at home.
Bingo. Yes.
I mean, that's just it.
But it's also, I'm not trying to interrupt you.
No,
but
absolutely.
There's also, this is kind of one of the cool stuff, actually, because it's also underserved communities, too. Like, I think about Williamsburg County as, locally, you can go in those and provide them services without, and providing that where they don't have to necessarily drive all the way out here. You can help them out.
That's where medicine is,
go to them.
Not where it's going, right? So people say, well, that's where we're going. No, we're there. There is we have to recognize we are there. So, we don't service all the way out of Williamsburg County, but to your point, there are points east, west, north, and south. I always joke, you can't go east because if you go east, you'll be practicing medicine out on frying pan shoals. Yeah. So it's, but if you go north, south, and west, all points, we have through our foundation and through, again, the giving of our employees, we have the Health Reach bus that goes out, almost 250 plus times a year. We have a Health Reach bus that goes out and does basic blood panels and does, or blood draws, does blood pressure, does healthcare checks. We have a 3D mammography van that goes out. Now, to your point, the telemedicine piece is the geriatric patient or the patient that may not have transportation, right? Yes, that's still an issue. Still an issue. Broadband, transportation, still issues in this country, still issues in this county. With that being said, the ability to get that patient here in person to
Mhm.
see X doctor
Mhm.
for Y reason, the next visit can be a follow-up.
Mhm.
Can be a follow-up to where now the the burdensome piece of transportation and time, a mother
Mhm.
who
Mhm.
has to leave work, a father who has a guardian, a brother, a sister, can they take their family member to X doctor for Y reason, and then the follow up can be done virtually? We're starting to weave those into what we do,
Mhm.
right? What you're going to find is, here's an interesting. I know you love data.
Mhm.
You appreciate data.
Yeah.
We have as many 65 and older patients as we do 35 and younger who appreciate the virtual medicine piece.
That's cool. That
There's a lot of similarities, believe it or
yeah.
not, in those in those demographic data points.
Yep.
And those two. So I always tell folks, if my parents can use an app, you
Mhm.
can too.
Yeah, but that's you're looking at from both the two main perspectives, not necessarily the
Mhm.
middle. And those are the people that use it,
Yep.
and they benefit from it too. And it's also going to the patient as opposed to going to them and showing that there's need, and then helping them through the process. That's why I look
Again,
at it.
taking medicine to the
Mhm.
community,
Mhm.
whether it be
Mhm.
our outreach bus, healthcare outreach bus, to our 3D mammography, to um, talking about the advancement and growth of our network, taking it to West Conway,
Mhm.
where we're going to be putting, something else too is different. The classic brick and mortar clinic, right, still
Mhm.
exists, still matters, still impactful. However, going into retail front line, for commercial inline retail places like Market Common,
Mhm.
like Conway, like Merle's Inlet and Pawleys Island, and places like that, where grocery stores, dry cleaners, you know, cosmetic places, to
Mixed use places.
your,
Yeah.
your
Yeah.
mixed use commercial retail, putting, putting a clinic in there, and
Mhm.
you kind of look at it and go, man, that's an odd place to put a clinic. It's absolutely the
No.
most perfect place.
Yeah.
It is the high level traffic areas of
Mhm.
everyday needs
Yep.
by everyday people. And I mean, that's not to say everyday people is we all have to buy groceries or get them sent to our home. I get it, Amazon or
Yeah.
Walmart, but the majority of people still buy their groceries, pick up their dry clean, and drop it off. They go and have a bite to eat in a cold beer somewhere,
Mhm.
right?
Yep.
And we have to put the medicine in place where they can access it
Mhm.
with better quality and better timing, right?
Yeah.
So, and convenience is key. So
Yep.
that's where taking
Inviting
it.
too. Yeah.
It's inviting
Yep.
it, right? So we're
Yep.
going to West Conway. We're going
Mhm.
to Little River. We've got an ambulatory surgery center on the south end.
Yep.
We've got
I like that building too. It's nice.
it's a beautiful building. We still
Yeah.
haven't even utilized, materialized the additional 3 or 4 acres next door to it. We're going into West Conway with primary care office there,
Mhm.
where there's a lot of growth coming, where Whittemore Park Middle School is coming, some other developments.
Yep.
We're going to have imaging there. We're
Mhm.
going to have, eventually when it fully materializes, we're going to have X-ray, CT, MRI, all that there, like we've done in Myrtle Beach, where we materialized imaging there. We're bringing on a place at Del Webb, right
Mhm.
down the street from the YMCA there.
That's
Well, man,
cool.
that's a great real estate spot, Trav. Hey, that's our leadership looking at it saying, what can we do to create bikeable,
Mhm.
walkable, golf
Yep.
cartable
Yep. Yep.
healthcare,
That's
right? That
smart.
matters
I
to
know
the
that Del
50,
Webb community. That's perfect.
55
Yep.
and older,
Mhm.
communities are more active than I think people give them credit for. And what can we do to take the medicine to those communities? Again, don't get me wrong. There's a business strategic vision and plan that's part of that, but you can marry good business
Mhm.
with good customer service and quality medicine. That's the other piece I makes want to touch on is the days and times are over with where quality medicine and customer service walk hand in hand. And if you
Mhm.
don't think they do, man, you are woefully behind the
Mhm.
times.
Mhm.
It matters. People want quality medicine and customer service to be equally as good, and they will seek it out. They will drive past it. There's a reason why people drive past other fast food restaurants to go to a Chick-fil-A or
Yeah.
go to somewhere like that, right? They know the quality of the food, they know the quality of the experience, they know
Mhm.
they know what they're
It's
going to
expected.
get.
Yeah.
It's expected,
Yep.
but it's also welcomed.
Mhm. Yep. Yep.
And that's what I just got a text this morning from a friend who just visited with one of our newer physicians, and the individual texted me and said, ex-doctor is wonderful.
Love it. Balancing
Wonderful.
healthcare services with customer service.
You have to.
Yeah.
You know, I think
Hospitality. Southern hospitality.
Hey, it's Southern hospitality.
Yep.
It's genuine care.
Mm-hmm.
It's my recruitment expectations that align with our leadership's expectations are, it's a very simple question. Would I send Cobi's mom or dad there?
Mm-hmm. Mm-hmm.
Would I send Travis's mom or dad there? Would I send my wife? Would I send my children?
Mm-hmm.
And if I cannot answer that question with a 100% confidence with yes,
mm-hmm.
that individual is not meeting the standard expectation of Conway Medical Center.
Right. Right.
Period. If you're in the service of your community,
mm-hmm. Yeah.
That's the expectation. You're 100%. In the service. It's just as simplistic as that. You know, we try to come up, you know, we in business, and we try to come up with all these flashy ways to say something, these great little one-liners. It's just that it's quality medicine with quality customer service. Like that's it. Like, well, what's quality? You know it when you see it. You know it when you feel it. It's eye contact. It's how are you doing? The hands down on the doorknob. How's your mom and dad? I know I'm seeing them next week. It's those things. It's you walk in and you see they've sponsored a ball team. You know, and you know they go to your place of worship. They go to the same grocery store. You know, it's all those little integral elements that's when you know it's quality. You know that they're taking the time. It's volunteer activities, not because they have to, but because they want to. It's the giving of their own finances for the betterment of their community, not because Brian Argo doesn't say, hey, you've got to do this.
Yeah.
It's I'm doing it. Our leadership does it. We're doing it because we know it's for the betterment. It's for the right thing to do. We know the dividends paid. Same thing with medicine, and that's something too. That's why, we brought on in the last 4 years, and I'd be remiss if I didn't touch on this. We've expanded primary care, pediatrics, neurology, cardiology, with interventional cardiology. We brought on orthopedics, full scope and scale orthopedics, pain management, rheumatology with infusion services, cancer care with infusion services, infectious disease. We brought on all those service lines. We've expanded GI. We have ERCP and EUS. We have EBIS with our Monarch robotic platform and Dr. Hafez Hayek, who's triple boarded. We have sleep medicine. We're pioneering a sleep medicine lab at one of our local accommodations partners down by the waterway.
That's cool.
And it's something that we saw in a larger metro market that worked. So we've got 6 rooms, 6 hotel resort rooms where your loved one can come in, and instead of being in a very stodgy clinical setting to try to figure out what their sleep apnea issues are, they can go be in a one-night 5-star or 4-star hotel resort and get an absolute wonderful night's sleep. And we can genuinely look at what is the issue, right? And they don't feel like they're in that clinical setting. They feel like they're in a setting where they can relax. There's a TV. There's an experience. They get the whole experience being at the hotel. And it's one of those things that matters. If we're going to try to think with true visionary strategy into the future, you've got to think outside the box of what we're doing.
Yeah. So if you're thinking the whole picture, you yourself, you think the whole picture of this whole community, what the impact can be done, and this, I guess, is a good segue into the next conversation or the next topic I want to talk about. I see downstairs, I know Conway Medical Center. I knew it has always been around for a long time. I didn't know it was 95 years. But you guys understand this community and understand the beauty of it. What are some strengths, that you would think that make it, attractive to operate in? No pun intended.
No, I think
maybe a pun intended, but
I think it's pun intended. I think too, it's one of our strengths is understanding the balance, but also when you need to bring a collaborative partner on. And we've announced recently that we are doing an equity partnership with Navant Health. Navant Health is a 10 billion asset healthcare system that is also a not-for-profit. And they are basically a 10 billion asset version of Conway Medical Center, just to be transparent. we are not, they are not coming in. It's not a takeover. It's not an acquisition. It's not a merger. It is a partnership from strength. We are doing it from a position of strength with a partnership because of strength. So for us, it's ambulatory surgery center. It's the expansion of that. It's imaging. It's new service lines. We're closing our ICU, CCU. What does that mean? We're going to be able to bring in a higher level of acuity to our center and also retain some of those patients so we don't have to ship them out of their community. Now, of course, if the appropriate and best medicine is at MUSC or a neighboring collaborative part of that, we share those, we transfer patients.
Everyone's got their own strengths.
Everybody's got their own strengths. So from a position of strength, but also understanding where your challenges are and where your growth areas are.
Acknowledging them.
And acknowledging them. So that's where, too, we understand we have a medical university of South Carolina and Charleston. So there's things that they do that we don't. But with Navant, we're going to be able to partner. They're going to be able to offer some things. So they are going to have installations and facilities that are as close, or if not closer, than in USC that we could also refer to keep that continuity of care here within our community. There are things that we have to adhere to because we are an independent nonprofit. We offer rural health as well, community health care. So we can do that from what do we do well? What do we offer? That equity partnership with them is a 30% equity stake where it's a 10-year commitment, $75 million over the next 3 years. So we can take our 1, 3, 5, and 10-year plans and really escalate those into 1, 3, 5-year plans. And Brian Argo and our board was instrumental, and the leadership team was instrumental in bringing this partnership about. And that's not giving my boss kudos for kudos. It's seeing that if we don't partner with someone of that size and scale and scope,
understand that
they're going to come here, right? So either we can partner with them and they allow us to do what we do great, which is serve our community for the betterment of our community, for generational healthcare change. We're doing this for the betterment of our organization and our communities because it allows us access. It allows our community access to a healthcare system that has mental health services for pediatric, adolescents, and geriatrics that currently we don't offer. It allows them subspecialty IM work, right? So we have almost every single specialty represented that you can offer, but from a subspecialty, for instance, like pediatric cardiology or endocrinology or orthopedics. Yes, we have those in the regional sense, but now we have a partner that offers those just across the state line, right? That we can get in and out.
In another quickly growing metropolitan area.
Right, again, between here and Wilmington is another area.
Oh, well, yeah, Wilmington. That's part of our MSA. That's actually
right. That's part of the MSA.
The Seaview Highway or whatever.
That's right. And so, again, from that position, we saw fit to pursue that relationship and that partnership. And again, we own. Look, on record, Brian talked about it. We still have ownership of our boardroom. We still have ownership of our balance sheet. We still have ownership of our vision, strategy, and where we're going.
Can you talk about maybe the strengths of the Palmetto State, that make it an attractive place to have a hospital? I think that you probably could touch on that really nicely.
I can. With my job as a recruiter liaison, I talk to candidates from around the world, American-born, American-trained to foreign-born, American-trained, and public, private, and collegiate schools that are quality, transportation routes that are improving, an international airport that has 1.2 plus or minus million deployments that's being expanded.
Love it.
That's being expanded to where we're going to be north of 200 million or 2 million deployments. You have American, Southwest, Delta, Allegiant, still Spirit. I know there's going to be that merger there, but what's it going to bring in with other routes, into our area? You have industry coming in. Correct me if I'm wrong, but I believe it was the FedEx.
The FedEx distribution.
The FedEx distribution center, and again, that's part of the 50, 100, 150 FTE type of the distribution of goods like that is not going anywhere anytime soon. If it goes to drone delivering, you're still going to have somebody monitor that drone, right? So it's workforce development.
Amazon distribution center.
Right. It's exactly right. So it's taking maybe the driver for FedEx and converting them to a drone operator, right? It's public, it's the schooling system, it's technical colleges, it's higher education, it's full-time sustainable non-tourist based industry, and that's not a knock on tourism. Tourism here is no longer the shoulder seasons. When you and I grew up here, and my wife grew up here, right?
Yeah.
She grew up in North Myrtle, Conway, Loris.
Yep.
I have friends that grew up in Myrtle and South End. I use that reference because we went from very agrarian tourism, right? The 3 T's of Horry County were timber,
turpentine,
and tobacco.
Tourism. Oh, there's also
the 4 T.
Yeah, the 4 T.
Right, that's where I was going. Now the 4 T is tourism, right? So, those 4 T's there, right, are the bedrock of what Horry County is now. But there's a 5th one coming. It's not a T.
What are you
an H.
What are you going to say?
It's healthcare.
Healthcare. Well, that makes sense.
Healthcare.
Yeah, that makes sense.
It's because
I agree.
You have to, right?
Yeah.
It's interwoven into everything we do. Education, healthcare are 2 of the most bedrock pieces to what we do from an employment perspective in this county. If you go look at those numbers, I mean, between Conway Medical Center, which by the way is the only healthcare organization that is headquartered in Horry County. Yes, there are others that provide service here, but we're the only one that's headquartered here. And then the other 3, competitors and/or collaborators based on the service, if you will, are in this county as well. But with that being said, it's as easy as it is hard. The hardest part is telling folks that we are a tourist destination, but everything's not about tourism, right? There are the educational pieces from K through 12 to technical colleges. I mean, find me a technical college that has an engineering, chocolatier, culinary arts program.
They do have a chocolatier program. I'm glad you mentioned that because that's something that I don't understand why it's not heavily emphasized. That's cool.
Try to find a technical college that has all of those.
And welding, nursing,
CNC, and nursing, and
they have a drone. They have a drone program over there.
They have a drone program.
Yeah.
And look, electrical work, plumbing work. You can come out right now and be instantly busy. With a job.
Make
higher
good money.
Education, right? Yeah. So then you've got the RIDE program 1, 2, 3 with all its challenges, but all its outcomes, right? Now we have RIDE 4 coming. It's also too, you're seeing a change in what is tourism in our area. Is it transactional? Is it experiential? Is it a little bit of both? You're seeing that change. You're always going to have some of that sun and the fun in the sand, transactional beach type experience, but you're seeing it because again, there's actually a multi-generational facet that's moving to our area where you have the retiree, early retiree, the 40-something-year-old parent, and the kids that are in K through 12.
Yep.
You're seeing it.
Yeah.
through healthcare recruitment, you're seeing that. Like our medical staff here is representative of what you're seeing, even right on down to the little bit of an international flavor and flair that's coming to our area. And I love food, so having a few more international spots to be able to get a little grub is always good.
I don't disagree. I love it. I love food too.
Trust
I
me,
love international.
My wife's chicken bog would win the Loris Bog off, but she doesn't. As a North Myrtle Beach girl, she's not going to offend anybody in Loris by doing that.
No, she's not. No, she's not. She needs to enter the chicken bog cook-off, by the way. I'm sure Cluck Norris, the bog off mascot, would greatly appreciate that. Can you speak on, I mean, this is just, it's mind-blowing what we're kind of talking about here, just all the opportunities. I like the concept of opportunity, and that's my mindset. And where you're touching on everything like that. When it comes to, and you did touch on this a little bit earlier, it's the concept of sustainable development.
Yes.
There's a couple different factors to it that I like to think about when it comes to that concept, not just necessarily the environmental component of it, but also workforce and the people aspect of it. Can you maybe talk about when it comes to maybe the development part of it, the physical aspect of it, what is kind of maybe touch more on the foundation. What's Conway Medical Center and doing the embrace the concept of sustainable development.
So we are. Well, you're sitting in an office that in the last 24 hours, this entire administrative services building just converted to completely green energy LED lighting.
Okay.
So it's little small components like that that we understand our green footprint, right? If you will, whatever slogan, cliche, one-liner kind of tag, if you will, when it comes to sustainability. But sustainability is, are we making sense? And are we making the best decision with the data and technology available to us today,
Mhm.
right? It's from a sustainability perspective, whether that be green sustainability, healthcare sustainability, experience with the customer, experience with healthcare. I mean, what is sustainable, right? And sustainability has many facets. So we can there's a litany of paths that we can go down. But I think to your point, how are we creating sustainability ultimately from a green footprint and
Mhm.
ultimately from a workforce development footprint?
Yeah.
And I think they go hand in hand. It's we're not naive to think that the generation, my daughter's 14, about to be 15, and the generation that's in college, that's recently come out of college and in high schools now, they are very health and environmental conscious, probably
Mhm.
more health and environmental conscious than any other generation we have ever had
Mhm.
in this country.
Yeah.
So they are going to bring things that are priorities to the table
Mhm.
where when they make decisions, it's, is this paper
Mhm.
recyclable?
Mhm.
Is this plastic bottle? Do we need plastic bottles, or do we go to? I have seen in certain cities, in certain healthcare organizations, they're reusable glass bottles that have a plastic cap that after you're done, you put that into a bin that slides in there. It takes the
Mhm.
glass bottle,
Mhm.
sends it back. They sanitize it, fill it back with mineral water, and give it back and sell it for $1, right?
Mhm.
But it's a sustainable. It's small things like
Yeah.
that to, looking at standpoint of, I don't know, everything from, what does our look like from a greenscape perspective? Are we putting things out that are environmentally sound and safe, to lighting, to the materials we use throughout the entirety of the hospital?
Yeah.
Hospitals, education, manufacturing, they're some of the larger um, producers of certain
Mhm.
non-sustainable and or could be sustainable practices, right?
Yeah.
So we're constantly looking at green ways to how we can be more sustainable in the continuum of sustainability, whether it be, you know, from food waste to, healthcare waste to, again,
But you
plastic
also,
bottles to
yeah,
everything.
but you guys are also embracing the concept, looking at the community from a holistic perspective. You're not just building when in the expansion of your buildings. You're not looking at just to build something. You're looking to add value to the physical
That's
value to
right.
that, and I love that. That's kind of also what I see. Is I'm not trying to put words in your mouth, but
No,
I love that what's going on with Conway Medical Center with that concept too.
it's what's also too, Cody, Kobe, excuse me. It's one of those things that the deliverables of a service and product,
Hmm.
be it healthcare, be it business, they are the same, but they change.
Hmm.
It's that classic, everything, comes full circle. The customer's expectations, the need of the community, there are bedrock foundational elements that never change. But then there are ways to deliver it, right?
Hmm.
You know, people, the consumer wants to talk about, you know, drone deliveries
Hmm.
or, having, whether it be medicine or your groceries delivered to your home.
Thinking
Oh
100 years
man,
down the road. Yep.
right. So
Yep.
they're thinking, well, let me. You talking about bringing the
Yeah.
past to the future?
Hmm.
We're not but two generations removed from a milkman delivering milk to someone's house,
Hmm.
and that was like
Hmm.
massive customer service, right?
Hmm.
That's no different than having Walmart deliver your groceries to your house.
Yeah.
That's no different virtual medicine being delivered into a home.
Hmm.
That's concierge.
Hmm. Concierge like that. Yeah.
Concierge service. We view concierge service as premium, or potentially you have to be some type of status, right?
Hmm.
Concierge medicine is delivering medicine in a quality, convenient way. Nothing more, nothing less.
Yeah.
Telemedicine to taking medicine to a community, to healthcare outreach, to mammography, those are forms of taking the service
Yeah.
or product to a community. That's concierge, man.
Hmm.
It's how we have to think of sustainable ways, but we have to think of ways that, do we maintain quality service? Do we maintain quality outcomes?
Hmm.
That's something too, and to touch on that briefly, that's where medicine's moving to.
Hmm.
Quality outcomes.
Yep.
Hospitals, medical centers, networks are being pivoted towards not only just, okay, the days of let's get 35 people in a clinic,
Hmm. Mm-hmm.
That's
Let's
not our approach to medicine here.
Mm-hmm.
The quality aspect. That's why I keep using those words purposefully.
Mm-hmm.
Quality medicine, quality customer service, because those two, more so now than ever in our industry, walk hand in hand.
Mm-hmm. Can you, as we kind of wrap up today, I assume this is going to be a couple of conversations down the road because there's a lot that we touched on that I'd love to go deeper on. But can you give me a little bit of our viewers a little bit of a heads up on the plans for Conway Medical Center for the next 10 years?
Yes, I think anybody that would sit here and say, "Hey, we have a 10-year plan, and it's we've got it fully materialized," um, you know, I kind of chuckle because the way technology changes, the way the needs of our community change. Our 10-year plan is built around those four pillars, which are patient and employee satisfaction. Those are two separate. Quality and financial sustainability. And I know it sounds like a very canned response, but back to my previous statement it's a journey.
Mm-hmm.
The next 10 years are a journey. Healthcare changed more in the last 3 years because of the pandemic than it changed probably the previous 15.
Mm-hmm. Mm-hmm.
Lord willing, we don't have another pandemic, right? But however, let's learn from that. Let's utilize that. Let's don't let that overall challenging time go in vain, right? For the betterment of humanity learn, grow, develop. Let's take that overall very, very challenging event in human history and in our communities. Let's don't let it go in vain. Let's utilize it for the betterment of generational healthcare change. So for us, those four areas: patient satisfaction, employee satisfaction, quality, and ultimately financial sustainability. And if we pursue those four areas in 10 years from now, I'd love to have this conversation. We're probably both doing it as a 3D hologram.
Yeah, and, that would be cool.
And,
like Star Wars, you know?
Right. So, it's the journey.
Yeah.
You hear that from so many people, but
yeah.
I think the more experience you get under your feet and then, between your ears, you realize the target moves, the destination gets further, but it's how do we continue along the journey? Because healthcare has been around since the beginning of time in some form or fashion, right? Be it mental, emotional, or physical medicine. It's been around since the beginning of time. So in closing, it's those four pillars that we're trying to get to from the standpoint of all our outcomes are based on that, be it medicine, be it customer service, customer experience, to new programs, new initiatives, new service lines, fill in the blank, right? If we're centering everything around those four pillars, we're always going to be from a position of strength for our community. And at the end of the day, last time I checked, you and I aren't getting any younger. So I'd like to make sure there's a good cardiologist here, a good GI doc, a good rheumatologist.
Travis, this has been an absolute fantastic interview. I appreciate you for joining us today.
Yes.
This is awesome. I love the investment that Conway Medical Center is making into the community with an eye on the future. Thank y'all for listening to this episode of Palmetto Happens with Cobi. Follow the show on the Grant Center for Real Estate Economics LinkedIn page, and also on my own LinkedIn page at Charles Cobi Williams MBA. And subscribe to our YouTube channel. And thank y'all for watching.